Hello, welcome. I'm Dr. Jonathan Yeap Hsiung. I'm the consultant emergency physician and head of ER in Colombia Asia PJ. So today I would like to share with you all on a lecture on heart and mental health disorder. So this is the outline of my lecture today. So overview of cardiovascular disease, then we'll talk about acute coronary syndrome, overview of mental disorder, depression, relationship between cardiovascular disease and mental disorder, and some tips on healthy lifestyle. So cardiovascular disease, heart disease, is according to WHO statistic in 2019, cardiovascular disease is the #1 cause of death globally. It's estimated about 17.9 million deaths per year, which is roughly about 30% of all the causes of death in a year. And one third of this patient is actually less than 70 years old. And out of this 17.9 million death due to cardiovascular disease, 7.4 million is due to coronary artery disease. So how about in Malaysia? So this is the top 10 causes of death in Malaysia for both male and female at all age group in 2019. As you see here, the #1 cause of death is actually ischemic heart disease, followed by lower respiratory infection, stroke, road traffic injury, and others. So ischemic heart disease is a very important disease that we need to take note of. So heart disease, cardiovascular disease, there are actually a lot of components to this. I know this slide is look like a lot of medical term, but don't worry, I will explain it in a more simple way. So #1 is actually coronary artery disease. Coronary artery disease is due to blockage in your artery that supply the heart. So example of the cases that we see usually is heart attack. Cerebrovascular disease is actually cases like stroke. Peripheral artery disease, in some patients, you can see that there is some blackish discoloration of the toes due to lack of blood supply to the distal part of the leg. So that's one of the example. Rheumatic heart disease usually common occur in teenager, and this is due to streptococcal infection that due to if you have a upper respiratory tract infection, and this bacteria actually go to your heart valve there. Congenital heart disease is those disease that when you are born, then you already have a heart disease. Like example, heart in the hole. Deep vein thrombosis is actually blood clot in your leg. So, but although there's a lot of subtype of here, we'll concentrate mainly on coronary artery disease because this is the main cause of death. So what are the risk factors for coronary artery disease? So we can further divide the risk factor into non-modifiable and modifiable risk factor. So what we mean by non-modifiable and modifiable means that things that we can change, and non-modifiable, the risk factor that we can't change it. So what are the modifier risk factor? So for example, physical inactivities, the person lack of exercise, regular exercise, eating unhealthy food like burger, fries, fried food, pizza, drinking alcohol, and also smoking. And throughout my experience in emergency department, I actually have seen a lot of patients that presented to us with heart attack, myocardial infarction. And one of the major risk factors, if you ask 8 out of 10 of that patient, most of them, this 8 out of 10 will have some history of smoking. So cigarette smoking is one of the major risk factors for getting ischemic heart disease. So how about the non-modifiable factor something that we cannot change? For example, genetically, family history, a very strong family history of heart disease. So if you have a very strong family history of heart disease, then you are more prone to getting coronary artery disease. aging process as we all grow older due to we are more prone to get hyperlipidemia, fat deposition, forming arteriomatous plaque. There will be higher chance that you will get ischemic heart disease. And if you can see, another thing is actually something called as metabolic syndrome. So heart disease is also closely linked with people that have hypercholesterolemia, that means high cholesterol level, hypertension, high blood pressure, diabetic patient. So all of this is very closely interlinked, and also obesity as well. Beside all this metabolic disease causing heart disease, having metabolic syndrome itself make you prone to getting dementia, cancer, polycystic ovarian syndrome, non-alcoholic fatty liver disease. So how do we identify a person that have acute coronary syndrome? That means blockage in your artery. So most of the patient will have chest pain. That is the commonest symptoms. So how do we describe the chest pain? Is usually is in the center of the chest or on the left side, and most of the patient will describe as heaviness on the center of the chest, or something heavy on the chest, or crushing type of chest pain. So the typical textbook presentation is that this chest pain will radiate to your jaw and also usually. And sometimes the patient might have other associated symptoms like difficulty in breathing. They might have vomiting, feeling nauseated, vomiting, or lightheadedness. And if you have a major heart attack, major blockage of your artery, most of patients will have a very cold and clammy skin. So if you can see this picture of your heart, the coronary artery disease is due to blockage of your artery. The artery there's a blockage of blood clots due to the arteriomatous plaque. In the next slide, I will show you more detail a bit. Okay, so this is our heart. So this is the vessel that actually supply the blood and oxygen to our muscle of the heart. It's called coronary artery. So let's zoom in one of this artery. So you see that how this acute coronary syndrome occur is that there is fat deposition at the artery, at the wall of the artery. So this is called plaque, arteriomatous plaque. So throughout, if let's say you did not take care of your cholesterol level or this thing, then it might actually become bigger, and sometimes this plaque might rupture. And when it rupture, it can form a thrombus here. Thrombus is due to clotting mechanism, form a thrombus, and because of this thrombus, it can cause reduce of blood flow and oxygen coming into to supply the muscle of the heart. So as the thrombus continue to grow, the blood that passes through become less and less. So this muscle away from this area will receive lack of oxygen, and then this muscle will start to die off. So you can see that if there's any major blockage, you see that the tissue become black in color, determined as myocardial infarction. That means the date of the muscle. And we know that time is myocardium. That means every minute lost, there will be more muscle that getting ischemia. The muscle will get die off. So time is very important if you have heart attack, myocardial infarction. So what are the common people that come in with atypical presentation? That means the symptoms that doesn't, if you have a person that with chest pain, it's easy to identify, oh, I have a chest pain, then maybe having heart problem. But there is also some people that do not have chest pain, but actually have heart attack. So the type of patient is female patient. Patient is more common in diabetic patient and in older age group. So this picture illustrate the common symptoms of heart attack in man versus woman. If you recall the previous slide that I mentioned here, female is actually one of the person that actually common to have a atypical presentation. So in men, usually you have chest pain, like imagine that I told you just now, squeezing chest pain, heaviness type of chest pain, and then radiating to jaw, nausea, vomiting, difficulty breathing. This is the common symptoms. But in female, chest pain is not always present. And sometimes the pain might be at the lower part of the chest or at the upper abdomen. Some patients also present with epigastric pain, the higher on the top of your abdomen, they might have pain there. It can be also a symptoms of heart attack. Person might have, in female also, some of them will have fainting episode, indigestion, and extreme fatigue. This is some of the symptoms that a female patient might complain of. So in most of the journal, the newest update, they say that a person that have atypical presentation can have present with one of these symptoms with or without chest pain, shortness of breath, excessive sweating, vomiting, or radiation of the pain on both the arm. So these are some of the atypical presentation of acute coronary syndrome. So like I mentioned before, time is muscle, time is myocardium, the heart muscle. So it's very important to actually seek treatment. So what to do if, let's say, you experience chest pain? So number one, actually to call ambulance, to call 999. So this is actually to, because ambulance can bring you faster to hospital. Do not actually drive yourself to hospital alone, because there is chances that when your chest pain becomes so severe that you are unable to drive, then there might be accident while you're on the way to hospital. So they in our latest CPG Malaysia guideline on heart attack, they actually you must call ambulance 999. So if you have aspirin at home, you can take 300 milligram aspirin. This will help you as an antiplatelet. It will help you to prevent the platelet aggregation, which is one of the first few steps for the formation of the blockage of thrombosis. Some of the heart patient will have this medication. This is called sublingual GTN. So this medication, you have to actually put it underneath the tongue. So you can, if you have that, if you are a heart patient and you're having chest pain, you can actually take one tablet, put underneath your tongue while you are waiting for your ambulance or while somebody is sending you to the hospital. Let's say in between you are still having this chest pain, then you can take another tablet. This medication helps to relieve your pain by vasodilatation of your blood vessel, means making your more blood flow in your blood vessel that supply the heart. So the ambulance will actually bring you to the closest hospital that have percutaneous intervention that can do this procedure, angioplasty, where they actually insert a balloon and dilate it to make sure that the obstruction, the flow is the flow that is obstructed open up again. So if you can see here, door to balloon time is actually 90 minutes. So the time that you enter emergency department to the time where they inserted the stent and making back the flow of the blood to your heart must be within 90 minutes. So time is very crucial. So you need to actually take action as soon as possible if, let's say, you develop any chest pain. And you should actually go to hospital that have a cardiologist that have that are able to do this procedure in a timely manner. The other alternative to treating heart attack, myocardial infarction, especially ST elevation MI, is actually starting a medication called thrombolysis, streptokinase. There's also another one is methylase, TPase type. So this medication is through intravenous, where you give through your granula, and then it's an infusion. So this medication will help to dissolve the clot so that it will open up the blood flow to your heart, to your coronary artery. And it needs to be done very time sensitive, like you see here. Door to needle time is 30 minutes. That means from the time the person enter our emergency department, and within 30 minutes, I need to start you on this medication if you do not have any contraindication. But definitely the gold standard of management of heart attack for myocardial infarction, ST elevation is actually percutaneous intervention, okay, which is this part on your left hand side of the screen. So I'll talk about the definition of health. So in WHO, they define that a person that is healthy when they must have these three components. If you see here, state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So you need to have these three main components to be well, to say that you are a healthy person. So physically, mentally, and socially. So what is mental health? It's a state of well-being where a person are able to cope with the level of stresses in the life so that they can work productively and fruitfully and make a contribution to the society. So if you see here, cope with stress, and then you can work productively and then contribute to the society. So this is the definition of a healthy mental health. So in this paper, they say that mental disorder is actually a major contributor of disease burden. They estimate there is about 300 million people are suffering from depression. And recent studies show that 14.3% of death worldwide is associated with mental disorder, and this is roughly about 8 million deaths per year. So there's a lot of people that pass away. Contributed, one of the risk factors is mental disorder. So is mental health common in Malaysia? So let's go to the next slide that I can share with you. So if you see here, mental health problem more than 16 years old of age is estimated about 29.2%. Sorry. It's about 4.2 million. So out of this, if you see, it's about 1/3 of people will have mental health disorder. And from this past 10 years, from 2006, there's only estimated about 12.2% of people having mental health problem. But these past 10 years, there's a twofold increase in the number of people with mental health issues. There's a study done on the public attitude towards mental illness by Yeap and Lau in 2009. So this Yeap is not me actually. So it's one of the studies that they have done locally. They say that there's 62.3% of people with mental illness sufferer actually doesn't want people to know. This is actually related to our Asian culture. So 1% believe that sufferer should not be blamed for their own condition, and 51.7% believe that people with mental illness are often dangerous and violent. So from this study, they concluded that stigma and belief is the main factors that contribute to the challenges as in our country is dominated by religious and spiritual explanation like demon possession. So in some people, they might be actually having mental illness. Maybe they are having some schizophrenia, depression, but the community might think that is due to spiritual, like let's say somebody have possessed, they will go and look for bomo, look for sensei to treat their mental health issue rather than seeing a proper doctor or psychiatrist. Risk factors, the contributor factors that making this twofold. Now, okay. So for this, if you have watched this abuse, financial crisis, and surrounding environment. Mental disorder. Globally, there is about 264 million of cases, they estimate, and is a leading cause of disability. And women actually suffer more compared to men in depression, and it can lead to suicide. And those that having depression, it will actually affect their function. Usually they cannot work or they cannot perform well academic in the school, or they cannot work well, they cannot perform in their tasks, and some of them, they even cannot take care of their own family members. And the most depressing part of having depression is actually some of these patients actually commit suicide. So it's estimated about 800,000 people commit suicide per year, and suicide is actually the second leading cause of death in people with 15 to 29 years old. The number one cause of death is trauma, actually. So for this young age group, so if you see 15 to 29 is actually the age group of productive individual. That means our golden years, we are working, they are very highly productive, they are our future of our society. So and we lost about so many patients due to suicide per year. So how to detect a person having depression? So one of the easy things is to use this mnemonic, SIGE, C, CAP. So we'll go one by one of this, then you know the symptoms of depression. Number one is S. So it's sleep disturbance. So I think when I tell the symptoms, some of you might agree that, oh, I think I so sleep disturbance, increase of sleep during daytime and decrease of sleep during nighttime. So you can see that daytime they are sleeping, and nighttime they have difficulty in sleep. So this is one of the symptoms. I is interest loss. So loss of interest in activities that used to interest them. Let's say, example, your hobby is playing badminton. Then you might suddenly loss of interest, then you don't feel like doing anything. Don't like to go to play badminton, or you don't. Normally you like to watch TV, but you don't. You suddenly lost all the interest. You don't watch TV at all. You just stay at home inside your room. Okay. Guilt. So G is guilt. It's feeling worthlessness. They tend to devalue themselves. So so these people will think that, oh, I think that I'm not good. I'm doing something bad. I don't deserve to be in this world. They'll be thinking all this negative thought and trying to devalue themselves. E is for lack of energy lack, fatigue. So the SIGE, then now is C, concentration is reduced, so they are unable to concentrate on the tasks that are given to them. Let's say, example, if you are working, then you are unable to concentrate to finish your tasks that given to you, or when at school, complete your homework, or doing the task that given by your lecturer or by your teacher. A person with depression will also have appetite loss, with or without weight loss. So they don't feel like even eating. And if a Malaysian tell you that they don't feel like eating, that means something is not right. So the next one is psychomotor changes. They might have anxiety or feeling lethargy. Okay, so SIGE, CAP. Okay, so the last one is actually suicidal ideation. So if let's say you do not treat this depression, they will go into major depression, and some of them will have suicidal thought and that they want to end their life. And most of these victims, they have a very tunnel vision, where they see that there's no other way that they can deal with the problem that they are facing, and the only solution is by ending their life. And if you ask the people that actually recover from all this negative thought, most of them, they say they regret having all this tunnel vision, because most of the problem can be solved but you need to get a proper guidance, proper discussion or advice from people. So what are the relationship between cardiac and mental disorder? Totally two different things, you might think. But so this is one of the studies that they say that people that heart disease, coronary artery disease, actually have a very high prevalence of mental illness. And vice versa, people that are suffering from mental illness also have increased risk of coronary artery disease. But how can a mental disease patient will have heart disease? So the next slide will actually show you how. So most of the people, let's say, example, you have a mental illness, mental problem, maybe you feel stressed, you feel depressed. Some people also say, oh, I'm better, I go for a smoke. They will increase of smoking. Or some people that are depressed or stressed, they will say that, okay, let's go out to eat more. Okay. So physical inactivity, they feel depressed or stressed. They say, okay, I want to be alone. I don't want to go out. I want to stay at home. So they're eating junk food, all those things, or vaping. All those things can actually contribute to higher risk of getting coronary artery disease. That is why just now that I mentioned, mental illness have higher prevalence of getting coronary artery disease. So if you see here, depression is actually an independent risk factor of getting heart disease. Schizophrenia as well, okay, and also anxiety. So depression is an independent risk factor, and they estimate there is about 30% increase of risk in the depression person to get a heart disease. And in schizophrenia, there are about 2 to 4-fold increase of death due to cardiovascular disease. And this is maybe because if they are having most of these schizophrenia patients, sometimes they might have some visual or auditory hallucination. Then when they inform, oh, I'm having chest pain, and sometimes people might just ignore them. Oh, I think this is his hallucination. So they might not even take it seriously. And some of them actually do have real chest pain due to heart attack, and then that's why it was ignored. People with anxiety surprisingly have 41% of increase of risk of getting heart disease. And like I mentioned earlier, people with patient with heart disease, acute coronary syndrome, also can develop mental illness. Like example, post-traumatic stress disorder. They estimate about 10 to 15% of this patient will actually develop post-traumatic stress disorder, especially after operation, coronary surgery. So how do we prevent both this mental and cardiac disorder? So one of it is by adopting healthy lifestyle. So if you recall earlier that I've mentioned, a person that is healthy should have this component of physical, mental, and social. So there is a study in this journal, Preventive Medicine Journal, in 2012 on healthy lifestyle behavior and all causes of mortality among adults in United States. So they conclude that people who actually do not smoke, consume a healthy diet, and engage in sufficient physical activity can actually reduce their risk of early death compared to those that smoke, having unhealthy diet, and do not exercise. So those people will have more prone to have shorter lifespan compared to those that actually practice healthy lifestyle. So what are the components of healthy lifestyle? So these are a few of the components: healthy diet, healthy physical activity, you must have a healthy body weight, try not to smoke, try not to take any alcohol consumption. So we go one by one. So healthy diet. So this is our Malaysian food pyramid. If you can see, what they suggest is to have more of carbohydrate type, like rice, noodle, bread, cereal, about 4 to 8 serving per day. You must have some vegetable, about 3 serving of vegetable per day. Fruits, about 2 serving of fruits per day. And then milk product, protein, fish, poultry, meats, and legume, about half to 2 serving per day. And try to eat less fat, less oil, less sugar, and less salt. Because if you know, like example, high lipid, high fatty diet is more prone to hyperlipidemia, then is one of the risk factor for heart attack. High salt intake is also associated with hypertension, high blood pressure. That is also is one of the risk factor for getting heart problem. And there's this campaign called Suku Suku Separuh, where you actually divide your plate into this this formation. So if you can see that quarter of it is your carbohydrate, your rice, your meat, your roti, your potatoes. Then the other quarter of it is protein, or the like fish, daging, the fat a bit, is actually your fruits and your vegetables. So try to follow this plate when you are taking your food. So this will actually help you to have a more healthier diet. Healthy physical activity. WHO actually recommend to have at least 30 minutes of moderate to vigorous activity. And what is this moderate and vigorous activity? Walking, cycling, and even dancing is one of the way. Besides working physically, if you recall just now, one of the other component is actually your social and mentally. So by exercising, you actually increase your socialization, networking, and identity. Let's say example, football or you play badminton. So you're actually interacting with your friends, networking, and then cultural identity. So let's say example, if in our country, most of the people play badminton, play football. In Japan, they play baseball. So this is some cultural identity of the people as well. They also promote social interaction and cohesion. It gives empowerment and confident, especially among children. And it also helps to promote lower work of absentees and better performance in school. So usually after you exercise, you get this endorphin hormone, a feel good hormone that after you feel more happy, and employee actually will have a much more better feeling of going to work the next day. And some people, they also found that after exercising, when they study, it's easier for them to absorb, to understand, to remember their schoolwork as well. This also due to increase of blood circulation, because as you exercising, your muscle is pumping the blood, so more blood going to your brain, then easier for you to have activities to remember things and memorize things. Next is healthy body weight. So it's recommended to maintain your BMI of 18.5 to 24.9. So how do you actually calculate this? Is by using your weight in kg, you divide by your height in meter square. So you just use your calculator, you write your weight in how many kg now. So you divide your height in meter. So let's say, example, your height is 1.7. So you put let's say 70 kg. So you use 70, divide by 1.7, then you divide again with 1.7. Then you get your BMI. Any BMI less than 18.5 means that you are actually underweight. You need to maintain within 18.5 to 24.9 is your normal range. And if you are more than 25 to 29, you are actually at the category of overweight. And if you're more than 30, you are actually in the obese category. And one of the things that usually people like to be number one, but one of the things that we are not proud of is actually we are actually number one among Southeast Asia in obesity. So if you can see in Malaysia, is 44.2. This is our numbers, and compared to our neighboring countries, we are way ahead of them. So we need to actually maintain a healthier body weight. No smoking. Like I mentioned earlier, smoking is one of the major cause for ischemic heart disease, major risk factor. Those that smoke, they have increase of chances of getting heart problem. Besides heart problem, there's also a lot of risk factor associated with smoking. COPD, chronic obstructive pulmonary disease, like something like asthma due to smoking, you can have that. Patients also are more prone to getting lung cancer. So smoking is actually not good. So shouldn't smoke. Okay. No alcohol, I would say no alcohol, although in WHO, they have some recommended how much alcohol intake that maximum a person can take. In women, they recommend 5 to 15 gram per day. Men, about 5 to 30 gram per day. And generally, one drink contains about 14 gram of pure alcohol. And that's about 12 ounce of regular beer, 5 ounce of wine, or 1.5 ounce of distilled spirit. But I do not recommend anybody to take alcohol. It's also associated with a lot of risks. Other than this cardiovascular, the person can get gastric ulcer, perforated gastric, liver problem, a lot of problem associated with alcohol. Okay, remember just now there's 3 main component. Another component is for your mental. You can actually do some stress reducing activities. Exercising is one of a very good way of reducing your stress. Some people, they can do yoga, they can do Tai Chi. Some people, they listen to classical music or laughing, watching TV, watching some comedy. You can also practice this guided visualization where you can think of a scenery or place to calm yourself down. Some breathing technique also can help you to actually reduce stress. Cognitive behavior therapy is trying to when you have experienced something negative problem, so you can actually try to change the way of perception, your way of thinking, to a more positive way. Having an annual health checkup is actually good for you, because you can actually monitor yourself, if your cholesterol level, your HbA1c for your sugar level, your kidney function test, so to see if you have any problem or not. For sometimes that you might have some symptoms that's associated with mental illness. Let's say, like example, the person might have some depressive symptoms or psychotic symptoms. Sometimes it can be related to hormonal problem. For example, hyperthyroidism is related to psychosis. So you need to actually do some blood checkup to rule out some organic causes before saying that the person is having mental illness or mental disorder. For screening of your heart, besides ECG is not really a very good tool for you to screen for your heart. So at least minimum you need to do a stress test. Stress test will roughly give you an accuracy about 60% for screening of your heart. For more accurate, you can do a CT scan of your heart, which give accuracy around 90%. Angiogram definitely is the gold standard. It gives 100% of any problem of heart disease can detect. So annual health screening checkup yearly is also recommended for you to maintain a healthy lifestyle. So these are my references. Any question? And I hope to, if you have any question, yeah, do feel free to ask me. Thank you. Hi, so I will try to answer. So how smoking and alcohol can lead to myocardial infarction is actually is a risk factor. That means if you smoke, you have they have made a lot of studies that there's a higher chances of the person getting heart attack, both smoking and alcohol. Okay. Yeah, so it's a higher risk factor. Okay. Okay. How can a heart attack affect your mental health? Okay. As you can see, just now the slide that I presented, a person that is having acute coronary syndrome heart attack, usually they'll feel stressed and depressed. They post-traumatic who is very productive. They are working like normal job. You are always working. You can go out. You can exercise. Suddenly, you develop a major heart attack. So now you, because of your heart is not functioning well, you are unable to exercise like usual. So you don't really have a good quality of life. So it might affect your stress. Some of the people that they might not be able to accept that they are having heart problem suddenly because they are fit. They will think that I'm fit, usually I can do everything, but suddenly I got a major heart. So that will actually affect their mental health. Okay. Next question. Can heart problem cause personality changes? It's not really causing a personality changes. It's just that that means it's not a direct. That means if I have a blockage of my coronary artery, one of the symptoms is personality change. No, it's not like that. It's just that a person that is having a heart problem, they might have increase of stress at that time. So all this stress and anxiety, it can be handled with a proper counseling, and you can this heart patient they can actually see a doctor or see a psychiatrist so that they can help them to actually solve their problem. To maybe a more proper explanation, because some of them, they are actually worried about their life, their health, their family member. What happened if, let's say, their heart suddenly stop? All those things will make a person to feel stressed, and sometimes when you feel stressed, that you'll be more emotional. But directly, it's not heart cannot cause a personality change on a person. What are the signs of your heart is quietly failing? Okay, some patient, if you have all these symptoms that I mentioned earlier, it can be a sign of your heart attack. But sign of heart failure, like your heart is failing. So most of the patient will present with difficulty breathing. They will have most of the complaint. They will the classical one is like you are walking for a short distance. Let's say like walking from here to car park. Then you suddenly feel difficulty breathing. Even for a short distance, less than 100 meters, you already start difficulty breathing. That's one of the sign. Let's say you are climbing your normal stairs, one flight of stairs. Normally you won't have difficulty breathing, but suddenly you feel like I'm more breathless when climbing the stairs. So that is one of the sign that your heart is failing as well. Patient that cannot lie flat. So that's one of the sign. But there can be other causes as well, but this is the common one. But for those that experience chest pain, it's better for you to actually come and see the doctor. You can, if you are having very severe chest pain, you need to go to the nearest emergency department. So to have yourself checked by ECG by the doctor, so to make sure that you are not having a heart attack. Okay. But by the way, my youngest patient that have heart attack, major heart attack, is actually 21 years old. Some of my colleagues have seen 19 years old as well. So age is not that means if you are young, you cannot say that I won't get heart attack. It's actually related to a lot of things like I told earlier, like your genetic, your family history, your lifestyle, your not. Next. Yeah. What is the best test for screening can do for their health? So, like I mentioned earlier, for screening for is actually the best test. The easiest is definitely stress test. So stress test, you basically you'll be on a treadmill. There will be a ECG lead, and there will be a monitor there. Then the doctors will actually when you are running, you're supposed to run on few stages, roughly about 20 minutes, depending on the person, at least 20 minutes or more than 20 minutes, depending on your stamina. So they will actually record your heart rhythm. So from there, they will try to see if there's any abnormal heart rhythm while you are exercising on the stress test. So that's one of the easiest way. But the accuracy wise is only, it gives you accuracy of about 60% to diagnose a heart problem. That means that there's still a 40% chances that a person with a negative stress test have heart problem. So CT scan of the heart can give a higher percentage of accuracy while doing screening, is roughly about 90%, where it involves just like a normal CT scan where you go inside a tunnel. Then they need to actually inject a dye, And this dye will actually stain your coronary artery so that they can see if there's any blockage or not. Gold standard of diagnosing heart problem is definitely an angiogram, but that is more invasive. Echocardiogram, which is the ultrasound of your heart, is a non-invasive, non-painful procedure where you can see the contraction of your heart muscle, any valve problem or not. So I would say the easiest will be actually stress test. But if you want more accurate, then you can actually come and discuss with our cardiologist. Then they will recommend based by the symptoms that you are having, your risk factor that you are having. Yeah. Okay. I think if there's no other question, thank you so much. Okay. For attending for this lecture.